Now, I want to jump into how can your tools help make it easier for employers to prevent harm and promote wellbeing at work?
Yeah, so it depends on the business size. So we do have a number of, or we have FlourishDx Basic, which is a freemium version of the full platform that is available for smaller organizations. Our sweet spot is 1,000 employees and plus, because the larger the organization, the harder it is to consult well with staff. When it's a smaller organization, you can run focus groups easily enough, or understand the employee experience without having to do surveys. But once you get larger than 1,000, then really you want to get more of a quantitative understanding where, like you say, you can drill down into groups within the business, whether it's a department, whether it's a specific team or what have you, to be able to quickly identify which teams are maybe having an issue, and focus your attention and resources to those teams rather than doing, global interventions that might not be suitable for, 90% of teams. So really focusing your resources. But also more frequently understanding the experience of workers. So the way that psychosocial risk assessments are often done is on a similar cadence to the employee engagement survey. It might only happen every 12 to 24 months if it's ever happened before, because again, we're talking about a lot of companies just being on the bleeding edge in relation to this. But a lot, as we've just seen over the last 2 years, Nicole, a lot can happen in 2 years. If you're only consulting with staff about the stresses involved with their work every 2 years, you can miss out on a lot of potential harm occurring. So what we were really conscious about was we don't want our surveys to be so academic that they take half an hour plus for employees to do. We don't want them to overlap significantly with the employee engagement survey. We're really conscious about how do we save companies time, with also doing very good levels of consultation. So we have two tools in particular that are really helpful around psychosocial risk assessment. The one that's most innovative is what we call our work factors risk assessment tool. It actually, rather than using more of a psychology framework or employee perception style survey, which most listeners would be familiar with in terms of employee engagement survey methodology, where you might ask 3 or 4 questions to cover a construct like workload, and then people will answer on a like it type style response, strongly agree to strongly disagree, for example. Rather than doing that, what we're really conscious of is people can have different experiences of stress based on a range of different individual and personal and life characteristics. Not everyone who has a high workload is going to perceive that as stressful. Similarly, not everyone who has low autonomy is going to find that stressful, but there's generally an assumption of high workload, low autonomy equals stress. So what we've done is taken more of an occupational hygiene exposure assessment methodology, which looks at the severity of stress that people are experiencing in relation to different psychosocial hazards like work overload or job control. We look then also at the frequency and duration of that experience. And that actually aligns really well to the new regulations that have come out in Australia regarding psychosocial risk management. It does actually stipulate, before putting in controls, companies must consider the severity, frequency, and duration of individual hazards, as well as the cumulative or the interaction of different hazards and how it might affect people's stress levels. And that's something that is really unique to FlourishDx. I haven't seen any other tool who have taken that exposure assessment methodology that covers those three levels: severity, frequency, duration, in trying to understand the stress experience of workers. So that one, we're getting to the point now where we're adding machine learning into to develop a predictive algorithm. And so the point is, like, within the coming months, we'll be able to say to a company, based on your risk assessment, if you were to do nothing, expect, say, 30% of your workforce to experience burnout, 20% to take time off work due to work-related stress. Yeah. So really actually giving companies an understanding of the likelihood and consequence of harm. And that is what a risk assessment should be. But even those tools out there that claim to be risk assessments using employee perception methodology, they don't actually give you likelihood and consequence of harm. They'll go, this is your score, this is the benchmark score. What does that mean? It doesn't tell you how many people are going to be harmed and in what manner. So that's the thing I'm most proud of, like actually changing the way that companies understand psychosocial risk. But then, when we do that quickly, so most of those surveys take less than 10 minutes to complete versus your standard psychosocial risk assessments, which are generally 30 minutes plus. The other thing we're doing is helping companies to monitor hazards over time through an even more brief assessment, which we call our wellbeing check-in. It looks very much like a mood check-in, But rather than just asking people, how are you feeling? We ask about the personal factors and workplace factors that are contributing to either a positive or a negative mood. And what that can do within the space of a minute at scale is give you a very clear understanding of, okay, what is the temperature? Like, how are people feeling? But importantly, what are the psychosocial factors that are having a detrimental impact on people's well-being? So that psychosocial hazard identification done within a minute per person, rather than, again, using a bulky survey that might take half an hour. And because it's so brief, that means we can monitor hazards, on a much more frequent basis, maybe every month or two, rather than, waiting a year or two in between kind of that consultation process with staff. And again, therefore we're going to be much more agile in terms of responding to hazards as they arise, rather than, harm occurring and then us responding reactively. So, really proud of, I guess, what we're doing in relation to FlourishDx. Like I said, it's all about how do we scale psych health and safety, but meet the needs of organizations. And I've got to say, the needs of organizations are very different to the needs of academics who want to publish in top tier journals. Yeah. Organizations don't need that level of survey to be able to understand the context and do good consultation. So we're trying to bridge the gap between what organizations need and what is good science.
Yeah. And that mini pulse check would be great to do if you're going through a huge change process, which a lot of big organizations, 1,000 plus, they do frequently. It seems
they do pretty frequently, yeah.
Yeah, so to check in and see how they're going and edit and make changes as they go, rather than get to the end of it and think, well, why hasn't everyone come along?
Yeah, absolutely. Yeah. And getting that information down to a team level, right? And that's what we're very much interested in as well. So giving line managers permission to see data from their team, obviously aggregate anonymous level data, but don't just have that data sitting centrally with the HR team. Actually, once we've equipped line managers to understand how to use this with their teams and supporting them through the functional team members, then let's give them that information at that team level so they can more quickly respond, rather than waiting for the organization to respond, which usually takes longer in a large bureaucracy.
Yes, it does.